Okay, as I've stated in a couple prior videos, when I started this channel, I really wasn't expecting it to explode. It's not the type of genre where you're going to get hundreds of thousands of subscribers. It's not Bob and Brad physical therapy where they're showing you ailments and how to treat them. More than anything else, I just needed to get it off my chest of what I think about this very corrupt field, and to tell some of the newer people how to navigate through it so you don't have a god-awful experience in your career. A professor friend of mine talked me into writing a book for travel therapists, just a 60-some page manual. I've been a writer before and he knew that. I really didn't want to do it, but he told me, before you leave the field, at least leave a little something for it. So I went ahead and did that, and started this channel to leave a final goodbye in my thoughts on the matter as a whole in the profession of physical therapy. But one of my few subscribers and frequent commenters, Mike, wanted me to do a video on the places I actually enjoyed in physical therapy. And this is important because the field doesn't have to be a disaster for you if you know how to navigate it properly. And I have a video on the playlist for the travel portion of this channel that tells you how to get contracts, secure contracts, interview for contracts. But I can also give a general rundown of places in the country that are good to work versus places that you probably want to stay away from. And there are some generalizations about certain places in this country, so I'll go ahead and do that. Let's start with my home state. I graduated from Indiana University, and I worked one job there as my first job out of PT school, and that was in the long-term care setting. But I've heard there's a lot of clinics in the outpatient that generally see more than one patient at a time. There's several major nationwide companies that operate in Indiana, and I've heard through the grapevine that many of my classmates are practicing this way, especially in the Indianapolis area. But I was only in Indiana for 6 months as a physical therapist, and then I moved on. Let me give you my assessment of other areas I've worked at. First, one state that I haven't worked at but is widely known to be hugely fraudulent is Florida. And it's not just fraudulent in the physical therapy world, it's fraudulent period in the medical world. Probably because there's a huge amount of elderly down there, and that just opens the door for some of these greedy corporations to get as much money as they can, whether by means fair or foul. I would stay completely away from Florida, unless you find that rare gem of a clinic that actually see patients one-on-one, and we're actually honest about that during the interview. Another area of the country you probably want to stay away from if you want to be an ethical therapist is the entire Northeast. Now understand, I know there's exceptions to the rule, but I have never talked to a traveler from the Northeast that wasn't seeing multiple patients at a time in the outpatient setting. And they're also reporting a lot of shady business going on in the skilled nursing setting, and that genre of physical therapy I left in 2009. But there is one state out there that you could work in the Northeast I've had pretty good luck in, and that's the state of Maine. And I would say the small towns, but pretty much every town in Maine is a small town. I think Bangor only has 35,000 people in it. I have worked in one home health company there that I butted heads with because they were completely criminal. But the outpatient clinics I worked there, they were all one-on-one. And I worked in Brunswick, and I also worked in Machias. Mainers tend to be decent people. They're very territorial. I know one clinic I worked in there in the outpatient setting, they had a prior company come in that was largely a mill seeing multiple patients at a time, and the small town just boycotted them. Because that's something that Mainers will do. They'll go ahead and wait on a waiting list that's 50 people long versus support an unethical company. Just like if you're a dishonest mechanic in one of these small towns in Maine, you're not going to last very long. So Maine is a good place to go, and it's also a beautiful state. The people are fiercely independent. Most of them don't want to come into physical therapy. Which sometimes, yes, I had to call a 70-year-old once who had a knee replacement because he decided to try to discharge himself from physical therapy because he didn't think he needed us. And I had to call him and say, yes, Mr. So-and-so, you do need physical therapy after a knee replacement. And I had to get his doctor to call him too and finally talk him back to coming in. But I'd rather have that attitude of go-getting and independence than the one who won't do anything at all. And that's your typical Mainer. Maine is a great place to work. And let's just move on across the country. Another state I worked in was Texas. I do not recommend Texas. Texas is known to not only have a lot of poor lifestyle in their patient population, but a lot of their outpatient clinics are at least unethical and many times criminal. I did not enjoy working in Texas, and at the time I was working in a rehab facility. The clinicians had an unbelievable apathetic attitude, as well as a lot of the patient population. I hear Austin's better, but I don't know for sure. And now as we're going across the country, let's check off Montana, Wyoming, and probably anywhere in the Northwest as long as you're staying away from the large cities. These people are also highly active. There are some clinics out there that are completely unethical. A lot of them are using technicians to do the treatments, in other words, unlicensed aides. But a lot of the outpatient clinics there aren't. And the people are all ranchers and cowboys. I call them fishermen like Alaska, except they ride horses. And as we move on towards the West Coast, let's talk about California. Now, California is a huge state. Northern California is vastly different than Southern California. Northern California doesn't even want to be part of California, period. Anywhere from about Central all the way down to the border of Mexico and California, I would advise to stay away from. And the thing is about these people in the Southern California region, in my video about how to interview for these travel assignments, and when I talk about how directors and managers will lie to you about the one-on-one treatment, and you'll find out they were lying once you get there, the Southern California region is the epitome of what I'm talking about. Dishonesty is a way of life out there. Northern California tend to be more mountain people because it's a mountainous area. The further north that you go in the Northwest region, the better your chances of finding decent clinics are. And like I said, use my video about how to interview and you can decipher who's lying to you and who's not. Because there's still many bad clinics that are out there, even in the good regions I speak of. And this leads to my last place, Alaska. Alaska is largely the only place I work now because that's where a great many of the good clinics are. The Anchorage area I'd stay away from. There's a major nationwide company that follows this multiple patients at a time setting. They have multiple sites all across Anchorage. You'll know it when you read about them. And there's also many companies that have 3 to 5 sites in the area, and they're pretty much following the same course. Where the best places to work are remote Alaska. And I've spoken of this before in my playlist on how to be a traveler. A lot of these places give free housing. And if you're a new graduate with $150,000 in debt, this is a great way to kill those loans quickly. And in these small remote fishing type towns, your patients are your neighbors down the street. You can't go to a store without running into a couple people that you've treated. So the general attitude out there is to do the right thing. Alaskans tend to do that. So in answer to Mike about places where I've worked, where I've gotten along really well, those are the main areas that I would flock to if I was a new grad. Now understand, there's an epidemic of these clinics that are seeing multiple patients at a time. And you're going to see that everywhere. Where you look for in Alaska are these remote places that only have one clinic for the whole island or small town, which is usually landlocked and you can't get to civilization outside the town unless you fly or boat in. They are great places to work. You become the town therapist. People will bring in salmon all the time during the fishing season. Really, really positive experience. And I wrote in a comment back to Mike, that's where he should go. And that's about it. That's my assessment of my 25 years in the field before I largely entered retirement. Occasionally I may pick up a contract here and there, and it will be to these remote towns in Alaska. That's the only place I'm willing to go now. The physical therapy field is a collective mess. It is a disaster. That is true. I say that on every video. I'm not trying to be negative. I'm trying to tell you it is what it is and needs to change. And well, you're going to say, well, I'm graduated. It's too late. I'm $150,000 in debt. Now what am I going to do? You can still have a positive experience in the field of physical therapy. I certainly did. You're just going to have to work at it a little more than most who don't care about ethics. And you start by finding these locations of area in the country where most clinics are good, or at least some clinics are good, versus places like the Northeast where they're all bad, minus that exception to the rule. Anyway, I hope that helps you coming out in the field, and I hope that you all start practicing ethically, so maybe we have a shot at returning this field to a state of honor once again.